Hello, everyone, and welcome to the PAPERI Bright Mind Series, held in recognition of International Childhood Cancer Day, ICCD 2026. This series brings together voices from different disciplines and regions to highlight how research, clinical practice, and health systems can work together to improve outcomes for children with cancer. I am Wafa Rashid, founder and chair of PAPERI, Pan-African BGS Education and Research Initiative, and I will be your host today. Today, we are honored to be joined by both Professor Maria Pombo-de-Oliveira and Dr. Daniela Palheiro Mendes de Almeida. Professor Maria holds a degree in medicine from the University of Pernambuco, a specialization in hematology from St. Louis Hospital, University of Paris 7, a research fellowship at the Royal Postgraduate Medical School, Hammersmith Hospital, London, and a PhD in cellular and molecular biology from the Oswaldo Cross Foundation. She was a visiting researcher at the New York Blood Center, New York. She is Professor Emeritus at the Research and Postgraduate Center in Oncology of the National Cancer Institute, known as INCA. She has experience in medicine with an emphasis on pediatric oncology hematology, mainly focusing on the following topics: acute childhood leukemias, molecular alterations in the etiopathogenesis of acute leukemias, and molecular epidemiology. Among her international scientific participations, she is the Latin American representative of the Childhood Leukemia International Consortium Management Group, known as CLEC. She serves on the editorial board of several scientific journals with 204 scientific publications in peer-reviewed journals. For Dr. Daniela Palheiro, is a medical doctor graduated from the Federal University of Rio de Janeiro with residency training in internal medicine and in hematology and chemotherapy. She has been a public health technologist at the Evandro Chagas National Institute of Infectious Diseases Oswaldo Cross Foundation, known as INI FIOCROSS, since 2015. She holds a certificate in public health from the University of Minnesota at 2021 and a PhD in oncology from the Brazilian National Cancer Institute in 2023, including a sandwich PhD period at the University of Minnesota. She led the Brazilian investigative group on vaccine-induced thrombocytopenia and thrombosis, known as VITT, and has a special interest in genomics applied to hematology. Since 2021, she has served as an ad hoc consultant in pharmacovigilance of events attributed to vaccination and immunization for the Brazilian Ministry of Health. She is currently head of the Transfusion Agency and the Hematology Department, is a professor in the postgraduate program at INI FIOCROSS, and a collaborating researcher in the National Genomic Network for Inborn Errors of Immunity. We are very grateful to have their perspective as part of ICCD 2026. Professor Maria and Dr. Daniela, thank you very much for joining us today.
Thank you. Welcome.
Thank you. Good morning, everyone.
Thank you. I have many questions for you. Let's start with Professor Maria regarding clinical and scientific foundations. From your experience in pediatric hematology oncology, what distinguishes infant and early age leukemias from leukemias diagnosed later in childhood?
Yeah, it's a very important question because it's important to see to pay attention of age of onset of the disease in childhood cancer, because the early age leukemia that consists in a broad of leukemia subtypes that included ALL, the majority of them, and AML, includes the group of infant leukemia and congenital leukemia. And this is important to think about how the the leukemia started during the uterine life. So by definition, this early leukemia should be seen clinically according to predictive factors. It means that children less than 1 year of age with leukemia is included in group of bad prognosis, poor prognosis, while with the group of leukemia from 2 years of age until 10 years of age represented the group with very good prognosis. And nowadays, this group of leukemia, the ALL, has a very good response to treatment and a very good outcome. So in clinical point of view, it's very important to separate this group. And for the pathogenesis, the early age leukemia that is up to 5 years old is important because they have association of particular subtype of molecular and cytogenetic partner. So that's very important to distinguish them. So
Thank you.
Okay, yes.
Thank you so much. So, how has molecular and cytogenetic research changed our understanding of the etiopathogenesis of early onset leukemia?
That's a very good question related to etiopathogenesis, because leukemia cell and the majority of them in this group of early age contain somatic mutations in his clone, and this somatic mutation distinguish the etiopathogens, and by clinically by therapeutic response as well. So some of these somatic variations observed is specific to some age group. And this abnormality arises from clonal hematopoiesis during the fetal life. They have, for example, a group that is associated with chemical factors, chemical exposure, chemical substance, such as KMT2A, MLL, with rearrangements, and some associated with immunological factors, like the case with hypodiploidy and leukemia with translocation TEL-AML1. So that's make a very important point in the understanding of the pathogenesis of early age leukemia, as well as associated with the different prognosis. Leukemia with MLL rearrangement is associated with poor prognosis, while children with leukemia with TEL-AML1 has a very good prognosis.
Yeah, okay, thank you so much. Now, let's move to another important issue, molecular epidemiology and prevention. Your work has strongly contributed to molecular epidemiology. What have we learned about prenatal or early life origins of childhood leukemias?
Sorry, I didn't hear the last question, please.
Yeah. My question related to your work, what have we learned about prenatal or early life origins of childhood leukemias?
We work a lot in studies to define or to characterize in Brazil the incidence rate of this early age leukemia in a population based, and also we did some case control studies to see the associated factors for this subtype of particularly looking at these subtypes. So what we learn about about this difference is that the infant leukemia that is characterized by the presence of MLL rearrangements are associated with chemical exposure of the mother during pregnancy, and while the case with the TEL-AML1 in children older than 1 year of age at diagnosis were associated with factors that involve the immune dysfunction. So this it was important when we look at this study, because some of these exposure factor could be prevented or have some strategy of prevention. For instance, the children with infant leukemia, in which we associated with chemical exposure such as pesticides and hair dyeing during pregnancy. This can be avoided, can be mother to be educated to prevent herself and her children. And while the other part is more difficult, because in Brazil and in some of countries, there is some lifestyle, social lifestyle, that is difficult to prevent, to get, or to impose, or to suggest prevention strategy. But for TEL-AML, for example, in hyperdeployed case, in one point indirectly associated with immune dysfunction, we found association with the cesarean section for these children, and this can be have educated to get more natural birth, for example. So I think in this context, the molecular epidemiology helps bridge the gap between the population, the biological mechanism, and the population level for prevention. This, I think, is a started point.
And there is a response from the population to your awareness and education. I mean, you actually exert efforts in education and awareness. This is what
yes.
I understand. And there is a response from population to your awareness campaigns or education through different channels, right?
Yes. For example, when we publish our data about exposure for mother exposure during pregnancy associated with some medicines and with some risk factor, for example, for some anti-inflammatory, excess of anti-inflammatory ingested during pregnancy, and hormonal use during the pregnancy, and so on, and also this hair dyeing association with the high risk of AMLs in childhood in the early age. This has a response in the media, and there was a lot of discussion about, and a lot of obstetrician and gynecologists reading these papers and try to explain the mothers during the prenatal. So I think this was a small step, but was a good step
Yes.
for created a behavior that could change
Cheers.
the incidence of infant leukemia. And also for other type of cancer in pediatrics, because for example, when we apply some strategy for one disease, discover others that in other way is associated with risk factors, you know. So yes, I'm very positive that we can make effort to 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 link this biology mechanism and prevention strategies. Yes.
Yeah, this is great. Now, Dr. Daniela, um, we will discuss your academic journey and doctoral research. So we need to know more about your doctoral research. We please unmute yourself.
Sorry, because
Yeah,
there
yeah.
was some noise here. Okay, so good morning, everyone. Um, Thank you, Wafa, for the invitation to be here and to talk a little bit of my career and my academic work. As you said, I did my PhD in oncology, and it was focused on hereditary predisposition to childhood leukemias. My advisor was Maria, of course,
Yeah.
and and particularly I was interested how germline genetic variants interact with environmental and infectious exposures during life. So this work kind of shaped my understanding of childhood cancer, uh, because I could see how this is a multifactorial disease. So this was my start um, in this academic work.
And
Work.
what, yeah, and what are you currently working on?
Uh, well, nowadays, I am, as you said, I am a technologist in Oswaldo Cruz Foundation, Fiocruz. I work at the Evandro Chagas Institute of Infectious Disease. Is a referral center for infectious disease. And now there I work in the hematology department and also in the transfusional agency, uh, seeing patients with infectious disease. And of course, I have this interest in genomics. So I am focusing my work on immune-mediated cytopenias, also more recently in inborn errors of immunity, and well, during the COVID-19 vaccination campaign, I worked using both my epidemiological skills and my hematological expertise, diagnosing and investigating a new condition called vaccine immune thrombocytopenic and thrombosis, as known as VIT. And so I think it's the beauty of science, because I learned so much about epidemiology for cancer, for childhood cancer, and during the vaccination massive campaign, I kind of applied it in pharmacovigilance. That is another thing, and But well, we can according to our needs, we can use the expertise to another direction. So after
Yes.
completing my doctorate, I was invited to join a network uh, which studies the area of inborn area of immunity called Renomie. It's a national genomic network, and it's led by Fiocruz. So I also joined this network. So
Yeah.
that's what I'm doing right now. That's my work nowadays.
Best wishes in your career, really. Move again to Professor Maria. Um, Let me ask you, as the head of the Brazilian Network of Childhood Leukemia Diagnostics, what have been the most important lessons in building national diagnostic capacity and the quality assurance?
Uh, right now, I'm retired, so
Ah,
my this network still is work on, but other new professional are work on this network. So that was my experience. That was very positive because we did a lot of education for doctors and professional that was far from the big cities, and where you know that in big cities things happen, technology arrives very fast and arrive, and it was well accepted while in the remote areas it's more difficult. So
yes,
this was important to approach case that was prevalent in some areas that we are not aware of. And during this study, we set up different laboratories, and technician and people that was connect with us, and the educating process was very good to help in get case for our study, in our case control studies. We we improve the, for example, the collection for incident rated populational base. So this was, I think, I point one of my on our very positive point of our study was to help the population-based registry that is set up in Brazil. That was at the beginning was very poor in data for example, for infant leukemia, for early age leukemias. Some case of leukemias would die without the proper diagnosis, or didn't have time to get access to clinical for treatment. So this network of offer diagnosis for this in this network was very important for this. So now it's very well established. Now there is no way back. So there is a lot of good connection, clinical protocols, and so on. That's one good point.
so, what system level investment are most critical for improving early diagnosis and risk stratification in childhood leukemia?
One for me, from our experience, was to the level of investment that I think should be uh, more should be more doing is to involve the clinicians and the all the health staff in studies that is associated with prevention, because it is still a myth that we can prevent childhood cancer. So
Yes.
that's not, because it's not a model like tobacco and lung, because always the context that is not easy to establish this strong association. The association with risk factor is weak. So I think the investment should be done in that, I think, in one of these, in this area, trying to show that it's not so difficult to uh, to get more education in this part of the chain. Yes.
Yes, you are right. Now let's move to an important part in our discussion, global collaboration and the equity. And my question for you, Dr. Professor Maria, what role do international collaborations such as CLIC play in advancing research on rare pediatric cancers, particularly in low and middle income countries?
We, since the beginning, I was very involved in CLIC during the early years. I was tried to understand how the group was built. We have, of course, the financial problem, because CLIC was not supported by our own foundation, and a proper way to, everybody has to get his only financial support. And but we have been working on CLIC since the beginning in this area of infant leukemia and early age leukemia, and we help in some to get some good numbers for to test again some risk factors, older risk factors,
Yes,
and I think this was good for us because we
yes,
involved more people here in Brazil, and also we 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 work in epidemiology, looking for collaboration inside and outside, and we learn how to apply the new technology for molecular markers. So in my experience in CLIC was all positive. Yes.
yes. Now, Dr. Daniela,
This investment is good because we try to equilibrate the inequalities, because we try to overcome the the bad conditions, or is a challenge for us. I feel the challenge to change the difficulties that we have in our way. Let's say that. So is that involve a lot of learning and teaching as well. So yes,
yes,
Click
you are right.
it was a very
Collaboration and pulling data together is an excellent way for education and collaboration and very effective results obtained
yes,
from Click. Yes,
yes.
you are right. Daniela, Dr. Daniela, you have been involved with the Childhood Leukemia International Consortium, CLIC. So let us know more about your relationship with CLIC.
Okay. Well, I was a observer in CLIC from 2016 to 2023, working in the Maria's lab for my doctoral thesis. And from 2019 to 2021, I was a postdoctorate associated at the University of Minnesota, supervised by Professor Logan Spector, who is the chair of CLIC. So uh, I was very involved uh, uh, in the discussions. Um and for me, it was a meaningful experience because this network represents the kind of collaborative and interdisciplinary scientific environment that has a strong influence. And the way I see the research in childhood cancer, because it's a rare disease, so making international efforts is very important to understand why kids have cancer and how to do the best to prevent and to treat them.
So you answered my question regarding next question. How the click academic environment shaped you? Thank you so much. Now at the end, we in this series end with a specific question for our guests. On the International Childhood Cancer Day, what's one priority action, scientific, clinical, or policy related, that you believe would most improve outcomes for children with leukemia? You can specify this for Brazil and then globally as you like.
Okay, so that's very difficult question because all of the action are priority in my point of view.
Yes.
Scientific, clinical, or policy related. I think the the clinical approach is now, I think it's for some types of, for the majority of the subtypes of childhood leukemia and cancer has succeeded, is very successful. I think the scientific is always associated with clinic. In my point of view, I always, when we work in translation now, this type of translation now, epidemiology, the scientific and clinical come together. So the policy related that I think should be more in the priority, because as childhood cancer is treatable and has to be treated in early, in very early in a clinical point of view. I think the investment should be, in my point of view now, in this policy related. And this will improve for sure the outcome, because it is still some in our countries, in low and middle low country, is still some problems to accept that childhood cancer is treatable and is curable.
Yes, you are right. So, what message would you like to share with young researchers and the clinicians working in childhood cancer in emerging research settings?
I feel that the young clinician and the young doctors is looking more for other type of speciality. I think we should attract more clinicians to work on childhood cancer, because it's an area with, although is difficult at the beginning to see a child sick, is an area that you can help a lot, because you can, there is a disease that could be as I say, cured, and is very good when you help. And I think we should attract more research and pediatrician to work on oncology. I don't know in our country, but in Brazil is very few, and very few. We need more clinical oncologists in research, in epidemiology, and that's one thing that is my message, is to see the way to attract them to work on childhood cancer.
So this is the message you want or call for action to policymakers, more
Yes.
staff in pediatric oncology specialty.
Yes,
Yes,
exactly.
I agree
Yes.
completely with you.
Yes.
Thank you very much, Professor Maria and Dr. Daniela, for sharing your insights and experience with us today. Your reflections highlight the importance of many aspects of childhood cancer in improving outcomes for children with cancer. We are very grateful for your contribution to the PAPERI Bright Mind Series and to the global effort to improve childhood cancer care. This conversation is part of the PAPERI Bright Mind Series for International Childhood Cancer Day 2026. Thank you for watching, and we hope these discussions inspire continued collaboration and action for children with cancer worldwide. Thank you very much.
Thank you. Thank you, Rafa,
Bye.
for
Thank
the
you.
opportunity.